My name is Richard Mwangi, a consultant audiologist and audiovestibular medicine consultant. We have partnered with Ponea Health, and today we'll be discussing the science of human hearing and balance. Now, to differentiate the hearing loss, several tests are done. First of all, is that in recent days that there is what you call newborn hearing screening, that you'll be able to test the patient, test the baby after birth, immediately after birth. You have different tests to do that, what you call distorted product autoacoustic emissions, or an ABR test. But most importantly is that when you do the hearing screening, you'd want to see, is the baby hearing organ okay? Is the baby, if the baby is discharged with the mother after delivery, will be able to develop speech, will be able to be, is able to hear perfectly, and also be able to develop speech at the age of his or her peers. Now, one thing that happens when you do the hearing test or the screening test for the babies is that you may find a pass or refer. When you talk of a pass, is the patient has got good results, or the baby has got good results, and he or she is good to go, and the milestone to take the course. So the patient, the baby will develop speech by babbling some words at certain age, and then eventually develop the full speech. Now, when you find that it's a refer, so many cases brings about this refer results. Because one, maybe the patient or the baby is not hearing very well, or there is a fluid in the ear, or the baby is not cooperative. So basically, there's a rule of thumb that we normally use. We say it's 1, 3, 6. So you diagnose or you screen the baby at 1 month. If the baby gets a refer, repeat the test at 3 months. And if the baby still gets a refer at 6 months, do diagnostic assessment and look for intervention. That's for the baby who has got a refer results. But for the baby with a past result, let the baby be and continue growing as normal child. That's about the assessing of a congenital hearing impairment. Now, for the acquired hearing loss, you'll find that depending on the age, the patient will not be able to do some of the tests because acquired hearing impairment can be acquired at any age, even when the baby is 2 years, 3 years, depending on what caused it. So you find that some of the traditional tests that has been used cannot be used for a 2 years old because some of them involve giving instruction and the patient follow those instructions. So for the 2 years old or 3 years old, will not be able to follow the instruction. So you find that there's a test that we normally do called auditory brainstem response, where the child is sedated or made to sleep, and then connect up with cables, and then the computer will analyze the hearing impairment or the hearing levels of this patient. Now, for the adult who can be able to follow instructions, or for the big babies who can be able to follow instruction, they have speech, they are communicating, but you still find that people they live with or the school teachers are complaining that there's a problem, or the baby seems not to be understanding, this baby seems to be following the conversation. The different tests to be done. First, you want to see whether there's any fluid in the middle ear, or if there's none of the fluid in the middle ear, you do what you call pure tone audiometry. We are giving instructions to the patient that the sound will be like this. When you hear this sound, you press. What you say is that you look for the faintest sound, and the patient will respond to that, and you plot again the graph according to that. Now, from that is how you'll get whether the patient has got a mild, moderate, moderately severe, or profound. What we talked about, the severity of the hearing impairment there before. Thank you for joining us today in this discussion. You can book my services at ponea.com. We look forward in engaging you more in the next episode.